I broke a 4-tooth bridge when I was in Asia, and in Bangkok I saw a dentist, and she sent me to an oral surgeon in Thailand, and their diagnosis was that I needed implants. And they suggested that I commute to Bangkok from San Diego, which was physically impossible. And therefore, we came home early, and I decided to go on the web and do some research. I looked for a surgeon who emphasized quality, not proximity to the border, and not cheap costs versus American costs. And I wanted a doctor who was responsible for the entire process. The surgery, the implants, the crowns, everything. And I found Dr. Carrera's website, and I checked with Loma Linda University to make sure. And yes, he does exist there, and he is there. And I read his website very thoroughly, along with the other dentists' websites. And the thing that I was impressed with was the thoughtfulness of his answers to questions that people had asked, and the way he explained the process, the entire process that you would go through. And I didn't want to personally interview dentists or surgeons because I found that in many cases you're getting a great salesman but not necessarily a good doctor, and I wanted a good doctor. So I set up an appointment for an evaluation, and I received the exam and the diagnosis and a cost breakdown and 2 possible treatments. I could go with a bridge, or I could have 3 implants and retain the crown on the back teeth if the back tooth appeared to be good. And I chose to have the 3 implants and retain the crown because I wanted the hygiene. And you should know that Dr. Alvarez emphasizes completely hygiene. And I wanted to be able to floss between my teeth, and that's important for me. So my first word of advice to anybody considering this is get a Sentry Pass. It makes the time coming back to the United States so fast. You just walk right through. Your commute time is cut by I don't know how much, but it is definitely worth the investment. And the other thing that you should remember is that this isn't a one-step extraction and 6 months later you return. You are going to be monitored through the entire process. Dr. Alvarez is going to check your healing stage, how well you heal. If he is concerned about your healing slowly, you are going to return to the office because he does care. And so with the Sentry Pass, that is not a problem. Second, I say warm clothes. The office is set up like a surgical center, and sometimes it's cold. They do have blankets, but it's for hygiene. Remember, if you have to go to a hospital in the US, you have the same problem. So it's not a problem, it's actually an asset. Would I do it again? Yes, of course. I have 4 functional teeth on top. I can floss. I can smile with confidence. And it's great. Do I have a problem, or am I afraid of going to Tijuana? No. It's like I live in San Diego. There are places in downtown San Diego I don't go. I know better. Especially at night. There are places in any large city in the world that people don't go to. And Tijuana's a border city, and it's like any place else. You just ask.
Okay. Thank you very much, and enjoy your smile.